Cervical herniated disc chiropractor. What the heck does that even mean? Hi, I'm Dr. Michael Pasternack, a chiropractor, Winchester VA, specializing in car accidents, auto injuries, neck pain, whiplash, and surprisingly, I see a lot of patients with cervical herniated discs and also lumbar herniated discs. I see it especially after car accidents. Well, let's talk a little bit about what a disc even is. So if we look at these models, this would be the bone, and then you could see this over here is the disc, so it's like a shock absorber. But notice if we look at this one, how that disc has gotten thinner compared to this one. So that's a disc that's getting thinner. Now that's different than a herniated disc, but I'm just showing you the disc. You can see here's the disc, here's the disc, here's the spinal cord, here's the spinal cord, and here's the nerve coming off the spinal cord, just like you see over here. And so a herniated disc, if we compare that and we look at this one for comparison, notice over here the jelly is leaking out. You can see it leaking out here, and in this case it's leaking out and it's affecting the nerve. So when you have a herniated disc, it could leak out just as equally and push back here. This is the spinal cord and be hitting the spinal cord. Herniation means there's a tear in the fibers of the donut, and now the jelly is leaking out. So that's what a herniated disc is. And I see a lot of that in my practice, especially after car accidents. And that's because of that force that happens, the whiplash, the head backwards, forwards, and then forwards again. And it happens in like a tenth of a second, or even really 100th of a second. And it tears things. And then you could have issues that come from that. I always make sure when I'm ordering an MRI that, I use a facility or two that I've really built a good relationship with, and they understand, what I'm looking for, so that I get really good quality MRIs and we don't miss any pathology if it's there, because you want to make sure if you have a herniated disc that I can see exactly where it is, what it's affecting, and know how to best manage a case, because I act as like a quarterback on these cases, and oftentimes I'm able to help with that. Oftentimes we need help from other providers like pain management, or I may need to send you for an orthopedic or a neurosurgical consult because it may be pushing against the spinal cord and we need to have other people look at it. But I quarterback to make sure you get the right care. In my office we use some specialized techniques to help improve the function of your spine and help minimize the effects of those herniated discs. Like for the lower back, I have a special table, and I've shown this I think on some of my other videos, that we can stretch and it sort of helps suction some of that disc back in. We use intersegmental traction to help put some stretch in the right direction to help minimize that. We do physical therapy type things like electric muscle stimulation, intersegmental traction. We use a cold laser. I have some incredible massage therapists at work here, and we do some deep tissue massage that really is amazing. We do some in-office rehab. So we take a very comprehensive approach to good as healing as possible, and I involve other providers in the community. So we really take this seriously, and so that's a little bit about a cervical herniated disc chiropractor and how that relates. If you're having issues and you're here in the area, remember I'm a chiropractor here in Winchester, Virginia. I'm happy to take a look at you. If you're not in the area, I encourage you to respond with any questions, anything I can do to help. Find someone that has experience and training in MRI and chiropractic and spinal biomechanical issues. Have a great day.